and I would request Shrenik sir, who is the pillar behind this particular initiative, to introduce him. And then, today's topic is about cancer, the treatment, and the way that can be cured. And we're going to talk about the Gujarat Cancer and Research Institute as to how it's making a difference in common man's life with its treatment. Where it's not hurting their pocket, their budgets, or their savings a lot. So over to you, Shrenik sir. Thanks a lot, Dr. Shashank, for joining us.
Thank you, Ravi. Dr. Pandya sir, very warm welcome to you. It is really great pleasure to invite you and having a nearly 55 minutes interactive session with you. Uh, as a matter of fact, for me, I'm having a special attachment with the GCRI in a short form, I would say, because I was one of the person who had undergone radiotherapy at GCRI in September and October 1997, and at that time, radiation oncologist was Dr. Babu. So he was kind enough. I was treated pretty well. So there is some attachment with the GCRI. Like there is no condition attached, and it's a wonderful institute, and especially for the people who can have a lower budget or other unable to manage the finances, and still they get very special, precise quality treatment at GCRI. So, sir, welcoming you once again, and we thank you once again for your valued time on this evening. Welcome, sir.
Thank you, Shrenik Bhai and Mr. Ravi, for giving me this opportunity. Thank you.
So, Dr. Shashank, we would love to know more about you, your journey till date, and about the institute, the research institute.
I have started my career in oncology since 1st January 1996. I joined this institute on 1st January 1996 as a student in M.Ch surgical oncology. And after completion of my M.Ch surgical oncology, I joined this institute as a fellow in surgical oncology, then clinical assistant, then junior lecturer, then assistant professor in surgical oncology, then associate professor, professor, head of the unit, head of the department, and I am appointed on 6th January 2018 as Incharge director, and subsequently I become regular director of the Gujarat Cancer Research Institute, which is one of the prestigious institute of the country.
Sir, can you talk about the Gujarat Cancer Research Institute and how it's making a difference, for a common man's life? I've heard, the charges or the cost involved in some of the treatments are like, surprisingly low. Can you talk a bit about the institute and its mission? And I'm still wondering as to why you have stuck to this particular institute without moving to a private institute or a private hospital, joining a corporate hospital. Why did you decide to continue your entire journey with the same institute?
Yeah, Ravi, the Gujarat Cancer Research Institute is one of the prestigious institute in the country. In each and every corner of the country you go, somebody will meet you that they are knowing GCRI very well. If we see the history of the GCRI, on 18th December 1960, Inner Club of Ahmedabad organized one program known as Veshbhusha, and they have collected money. That money was given to then Governor, His Excellency Nawab Mehdi Nawab Jung, and they have created the Gujarat Cancer Society on 2nd April 1961 under the presidency of His Excellency Nawab Mehdi Nawab Jung. First on for foundation of the cancer hospital ceremony was done on 26 January 1962 by His Excellency Nawab Mehdi Nawab Jung. In 1964, Meghji Petraj Shah Trust, MP Shah Trust, London donated £55,000 to the Gujarat Cancer Society for the noble cause of cancer, and the name was MP Shah given to that cancer hospital. And inauguration of MP Shah Cancer Hospital was done on 14th December 1966 by Honorable Prime Minister Srimati Indira Gandhi. So this is the history how it has started. In 1972, through the tri-party agreement between Government of Gujarat, Gujarat Cancer Society and the Gujarat Cancer Research Institute, formation of GCRI done on 1st February 1972 through tri-party agreement. And this is the first successful public-private partnership model of the Gujarat that is timely tested and functioning well. So for better functioning, autonomous status given to this hospital and name given as Gujarat Cancer and Research Institute GCRI. Then subsequently, Government of India has recognized this institute as Regional Cancer Center, and then in 2015, Government of India has recognized this institute as State Cancer Institute. So under the State Cancer Institute, it is under development and phase 1 is almost on completion, and after full-fledged development, the bed strength will be 1000 from the present bed strength of 650 bed.
Wow.
At our institute, we have all department: surgical oncology, medical oncology, radiation oncology, oncopathology, microbiology, anesthesiology, radiology, medical physics, community medicine, cancer biology, and research wing. For teaching purposes, the Gujarat Cancer and Research Institute is affiliated with the BJ Medical College, Ahmedabad, and Gujarat Cancer Society. If we see the teaching courses at GCRI, we are running DM Medical Oncology, 10 seats per year. Intake is 10 seats per year. M.Ch Surgical Oncology, intake 10 seats per year. Gynec Onco, 4 seats per year. DM Oncopatho, 8 seats per year. MD Radiation Oncology, 8 seats per year. And it is increased 9 seats per year. Even we have started MD Palliative Medicine, 2 seats per year. MD in Anesthesiology, Radiology, and Microbiology course is also available at GCRI. If we discuss, at GCRI we are running MSc Cancer Biology course that is unique in India. Even we are running PhD Life Science courses. We have started MSc Medical Physics, that is first in Gujarat, and MSc Medical Physics is more important for radiotherapy department. And if we have to develop more and more centers in Gujarat, then we require more and more number of medical physicists as per AERB norms. If we do not run this course or we do not start this course, we will not get enough manpower and there will be lot of problem. So we have started MSc Medical Physics also from this year. We are also running certificate course in Medical Radiation Technology, CMRT. So according to our need and according to the need of the state, we are running different courses, and with full-fledged staff, we are running all these courses, and we train juniors and we develop the new trainers for the oncology wing. If we say, just like corporate hospital, in surgical oncology department, we have organized speciality also. If we go thoroughly, then in surgical oncology, we have head and neck oncology division, breast and thorax, GI, musculoskeletal, means ortho-oncology, uro-oncology, pediatric oncology, neuro-oncosurgery. So all divisions are there, just like corporate hospital. And our colleagues are doing wonderful work there also. As per our responsibility of the GCRI, GCRI is running Satellite Cancer Care Center in the state of the Gujarat. At present, we are running two centers, one at Sidpur in the North Gujarat and another at Rajkot in the Saurashtra region. There also we are giving cancer treatment, we are running our center. In near future, we will start another center at Bhavnagar also. So as per our responsibility, we are doing our work wherever it is required. GCRI go there and GCRI serve the people. For cancer awareness and cancer detection, we are doing regularly camp. Then Director Dr. P.M. Shah has started new concept through Sanjeevani Rath. We are going all over Gujarat with the Sanjeevani Rath. Our staff will go there and they will do early detection camp in the form of mammography, pap test, oral cavity examination. These
Wow.
three cancers are main chunk of the cancers. These three cancers are the main bulk. They are approximately 49 to 50% of all cancers. So, as per our social responsibility, we are doing regular camp all over Gujarat with the help of the Sanjeevani Rath. Even in Ahmedabad, also GCRI also running one community oncology center that is known as COC Vasna. There is also we have hospice care. Terminal ill patients will be treated there free of cost, and we have cottages also there, and we have wonderful exhibition also, and that exhibition regularly visits our young collegians, and if they will not quit their habits, they will become victim of this type of cancers. So that is also one of the wonderful exhibition, and I would like to request all youngsters, those who are having any bad habits, they should visit there and they should quit their bad habits. So this is the history of the GCRI. As a social responsibility, GCRI, what doing at present and what courses are running at GCRI. You have asked why I have joined the GCRI, and yeah, uh, many times we think that money is important, but I believe that we should not never run behind the money. If you run behind any things, that will go away and away. I believe in God. If you don't run behind any things, that will come automatically in front of you. That is my main principle, and I believe in God.
Super.
Even I always tell my students also that during your study, get more and more knowledge, and in life also, never run behind the money. Money is nothing but byproduct of your knowledge. So even during the study period, I always tell my students that never run behind the money in your life. Another thing, I get more work satisfaction at GCRI. And when we'll get lot of blessings from poor patients, elder patients, I cannot even uh,
Yeah,
in
that's
which
more
what yeah
that's more fulfilling than
yeah
anything else.
blessings, lot of blessings. When I tell my colleagues, my employees, my juniors that we are getting lot of blessings. Money is not everything, and in my life, there is blessing is more important than money. At present, we are getting reasonably good amount in the form of salary. So I request each and everybody that don't run behind the money, serve the poor patient, and someone has to work in this type of institute. So this type of institute will run and we can serve the poor patients. And that is responsibility of someone. If everyone will go to the corporate, then who will serve the institute? Who will serve the poor patients? In this institute, we are getting approximately 29 to 30,000 poor patients per year. New cases per year, 29 to 30,000 per year. At GCRI, if you go the data of the surgeries, we are doing approximately 12,000 to 13,000 surgeries per year. If you go data of the radiotherapy, we are giving radiotherapy approximately 7,000 per year. So at GCRI, we are doing lot of work, and lot of work. Even at our center at Sidhpur and Rajkot, we have started radiotherapy and chemotherapy also. For poor patient, you have asked me. GCRI is the first successful public-private partnership model of the Gujarat state. Tremendous help to the poor patients. Fortunately, nowadays we have different schemes. If we go through the number of schemes, PMJ scheme, Ayushman Bharat PMJ scheme. Our 70 to 75% of patients are from the Gujarat state, and 25 to 30% of patients are coming from adjoining state or all over the India. Those patients are coming from the MP, Maharashtra, Bihar, UP. They are also covered under PMJ. So because of the PMJ, we are treating them free of cost. We have different Yojana also, scheduled caste, scheduled tribe, school health from Gujarat state. In scheduled caste and scheduled tribe, we are giving free treatment across the India. School health Yojana of the Gujarat state. Under this scheme, we are giving free treatment to all children of the Gujarat state up to 18 years of age. Those who are not covered under one or another scheme, we are giving benefit of another scheme that is known as LIG, low income group. In LIG, if patient is not covered under PMJ, SCST, school health, then we are giving option for LIG, low income group. In that scheme, patient have to bear only 50%, and 50% will be borne by the institute. Another scheme is CM Relief Fund. If expenses is more, patient do not have any money, and patient is not eligible for any scheme, if patient requires bone marrow transplant, then we will advise for CM Relief Fund, PM Relief Fund. Even after this type of schemes, if patient required help, our GCS, Gujarat Cancer Society, I have said that they are helping lots. And even for few patients, we are helping through our donors also. If ex-patient is treated successfully at GCRI and at the time of discharge, they will meet me. If financially he is well-being and if he is ready to help, there are many patients at the time of discharge comes and meet me that, sir, if any type of help is required, tell me. Then I am giving information that sometimes we may require fund for poor patients. We will get the number of the donor, and whenever we require help, we'll inform that donor that patient X or Y is there in that ward, and our person, we will communicate and contact both parties. So this type of donors are also available, and they are also helping our poor patients, those who are not covered under any schemes. Other thing, if patients comes at GCRI, if I give the example that for breast cancer, that is common cancer in female, breast cancer. If patient do not have any schemes, if patient is taking treatment in general ward and patient do not want help from any other, then for surgery of the modified radical mastectomy charge is only 4,400. 4,400.
Wow.
A
That's
patient, a patient is taking a patient is taking treatment in special room. Surgical charge for modified radical mastectomy will be 8,800 only. So charges are very less. Even in many cases, we are getting help from ICS, Indian Cancer Fund also. They are also helping our poor patient. So whenever patients are coming here, majority of patients are getting help from one or another scheme of the government or help from our GCS or our donors, but they are treated successfully. If we see our department, in medical oncology department, we have bone marrow transplant unit also. In BMT, we have approximately per year, we are doing 45 to 50 bone marrow per year. So that is also good number. Majority of our patients are getting free treatment there. Even patient, if any patient does not come under any schemes and patient do not want help from any other donor, or if they have to take paid treatment, then treatment will be finished approximately around 8 to 10 lakhs. Bone marrow transplant will be done at GCRI. So that is very less, very less. If you compare other center, the cost may be too much high. For poor patient, we are always helping. If you see the department, radiotherapy department, all our department are well equipped. In radiotherapy department, we have 4 linear machine, linear accelerator machine, brachytherapy unit, CT simulator. In phase 1 development, we have, which will be functioning within few months, we have CyberKnife also. I think GCRI will be the first institute in India that in government sector, CyberKnife will be the first at GCRI in government sector.
super.
Yeah. We have tomotherapy also, LINAC, brachy, everything is there. So for technology wise, we never compromise, and we see that our patients should get better, and best treatment at affordable prices. So my humble request that if any needy patient wants treatment, they can approach GCRI.
Okay. Thank you, sir. Thanks a lot. You've explained all the schemes so well. I mean, this is surprising. I mean, when I look at the cost that is involved with respect to surgery, the cost is very surprising. And most importantly, what you're saying is, if there is a customer, there is a patient who is coming from other states apart from Gujarat, though this is an initiative by the Gujarat Cancer Society and GCRI, they get the same treatment. There is no differentiation.
Yeah.
They can apply for the same yojanas which are there, the schemes which are provided by the government and other NGOs, and they get the same treatment at the same cost. There is no discrimination whether he is from Gujarat or not.
No discrimination.
Superb. That is
Same
just awesome.
ward, same ward, same operation theater, same faculty, same staff, same OPD. Everything same. There is no discrimination for anybody, whether patient is getting free treatment or paid treatment. No discrimination at all.
Wow. Just superb, sir. And
Yeah.
with respect to state, there's no limitation. Anybody in India, can come to this particular institute and seek help and take the treatment. And you're also mentioning that you have technology which is at par with all the other hospitals. So all the technologies are available in this particular institute, so they don't have to look for other options where so much of thing is available at affordable cost here.
Yeah. Even here,
Wonderful.
We have nuclear medicine department, which I forget to mention. We have two PET-CT, gamma camera, and we are doing PET-CT at the lowest cost. For paying patient, we are doing PET-CT at the rate of 9,900. That is lowest in Gujarat.
Okay. I'm surprised way you are confidently quoting the number, 4,000 change, 8,000 change, 9,000 change for everything, where the patient doesn't have to worry about anything. मतलब हर जो किसी भी हॉस्पिटल में जाओ, they say approximately this much, ये approximately इतना होगा, and you only get receive surprises by the end of the, by the time of discharge, bill कितना आएगा. There's whole lot of ambiguity by the time you get discharged. But here, you're so confidently telling that this is the figure you will pay. I mean, that is just, remarkable. I think we need more institutes like this across India. So, Shrenik sir, you want to add something here?
Yeah, by all means, Ravi, one of the key reasons of inviting Pandya sir for a very simple reason. Irrespective of his experience and being absolutely down to earth individual, I know him for a quite long time. One of the key reasons of inviting Pandya sir on this platform is simply extending somewhat to those people who cannot afford the treatment at a higher cost, and at least my major concern. This was my major focus. That not only in Gujarat, not only in Ahmedabad, not only in Gujarat, but people across India, they can reach out to GCRI for a very very affordable treatment. And and another great part what Dr. Pandya had said is, when patient is approaching them, they know for sure that it is not going to be like a shot in dark. They know what exactly they are going to pay at the time of discharge, and this is unbelievable. At least patients and especially caregivers, they will be certainly having so much of the comfort level. See, when cancer is diagnosed, they are undergoing so much of the trauma, and over and above the financial burden is another trauma, causing so much of social, financial, and psychological disturbances. So, approaching GCRI, and again, I know some of the faculties. Uh, I mean, on and above, I know, but as well, I know some of the faculties in GCRI. They are very good. I'm having a very good acquaintances, and believe me, they are doing a wonderful job. I'm saying that post on social media of the performance of the surgery, treatment, and the ultimate outcome after the treatment. I am seeing on social media, and when you see them, when you meet them, again, they are absolutely down to earth, very soft spoken, very careful, and absolutely, whoever is working in GCRI, I would like to go down with my joining my students. They are
Oh,
doing wonderful. They are really doing wonderful work. There is no comparison at all. Absolutely no comparison. And then the quality of the treatment is absolutely at par, and that is the best advantage ever.
Yeah.
Thank you, Shrenik bhai.
Sir, I have a question. So, I mean, the institute started in 1960s, and it has evolved. It has brought in a lot of technologies, uh, and now you're saying the phase one of expansion from 650 beds to almost 1,000 beds. The institute is expanding. The hospital is expanding. Uh, in one of the sessions, we were discussing, how do we, match the treatment, the number of cancer treatment, I mean the patients are like increasing, rapidly increasing with the population increasing, बहुत लोगों को cancer आ रहा है. So but the number of institutes like GCRI and the Tata Memorial and all that, they're like limited, and where a lot of corporate hospitals are also increasing. Are there any plans to increase the number of seats also? Like you're talking about 10 seats for every, speciality. Are there any plans to increase that also? Because we need more doctors like you, who are, onto the field, more professors like you who are, making better doctors and, sending them on to, doing this particular seva. So any plans on that? Because I thought, you're the right person to answer this, because you've your pathway of from lecturer to the professor, and then running the institute and all that. So I thought I'll ask you the question directly.
Yeah, definitely. We have to think definitely that we have to produce more and more qualified doctors. So whenever we have enough staff, and according to the need of the state and country, we are applying for increase of seats. Initially, we got permission in M.Ch Gynec Onco only for 1 seats. Then we have applied for increase of seats, and M.Ch has given permission for 4 seats. And from last year, yeah, we got 4 students per year. In coming years, we are planning to start M.Ch Head and Neck Oncology, DM Hematology. We are planning for that. But before starting, we should have enough strength in the form of faculty.
Right.
So definitely we can get recognition from the National Medical Council of India. I would like to add few things regarding the institute.
Yes, sir.
Our
Please.
staff, our doctors, all are dedicated. From 1st April 2019, we have initiated that we should work extra hours. Daily, we have started our workings in radiology department, radiotherapy department, surgery department, anesthesia department, that we should work 9 to 7 instead of 9 to 5. In extra hours, we are doing imaging. We are giving radiotherapy treatment to the more patients. So we can decrease our waiting. And like that, we have decreased our waiting list in surgery. We have started our OT 9 to 7 daily. On Saturday, our regular time is 9 to 1. But instead of 9 to 1, we are running our OT 9 to 5. And on Sunday, we are running 3 OTs 9 to 1. Instead of holiday, according to the rotation, staff is coming. So all are dedicated. All are doing great work, and salute to all of them. They are doing dedicated work during extra hours on Sunday also, and even on Saturday also. And because of this, we can decrease our waiting list. Many times we have waiting list for surgery for about 4 weeks. But because of this system, we have decreased the waiting list of surgery to approximately 8 to 10 days. Patients comes at GCRI for 8 to 10 days. That will be during that period, patient will go for metastatic workup, and that will be finished within 8 to 10 days. And after that, if patient requires surgery, patient will be posted for surgery. If patient requires chemotherapy, we'll send them for chemotherapy or radiotherapy. Whatever treatment is required, we can start as early as possible. Because many patients Those who are coming at GCRI, they are asking mainly two questions. Those who are financially not affording, they will ask only two questions, that how much charges I have to pay and what will be the charges of my treatment. And second question, usually they ask, sir, my treatment, when will you start? There should not be any delay in surgery. There should not be delay in radiotherapy, or there should not be any delay in chemotherapy. If state-wise patient do not require any surgery, if uh, hematological malignancy, straightway patient will be started chemotherapy. If patients are coming after surgery for adjuvant RT, they will be started straight away radiotherapy. So, because of my staff members, my colleagues, we are running our hospital extra hours. When we are doing surgery on Saturday, instead of 9 to 1, we are running our OT 9 to 5. And on Sunday, even though Sunday is holiday, we are running 3 OT for 9 to 1.
Superb, sir. I mean, that is really good initiative. Uh, as a leader for this particular institute, I think this is a very good initiative for stretching a bit few extra hours to save those poor family members who are already suffering. उनका टाइम थोड़ा वेटिंग टाइम कम होगा एंड दिस इज़ व्हाट वी कॉमनली हियर दैट द वेटिंग टाइम इज़ वेरी हाई in most of the institutes, and because of that they go from second stage to third stage, and third stage to fourth stage. And I agree with you. 5 बजे क्लोज करके एक डॉक्टर after the entire day, they are definitely very tired. But while they're going out, seeing those patients who are still waiting for their chance, it is very heartwarming. I mean, वो घर भी जाएंगे early, they will have this effect saying that यार और थोड़ा stretch कर लेते थे. And I'm sure doctors and the staff members don't enjoy their family time if there are a lot of other families who are waiting, eagerly waiting for him or her to do the surgery. So yeah, hats off to the entire team for doing this, because I've seen a lot of non-government organizations doing things, but stretching in a non-government organization, doing this thanklessly again and again without any commercial expectation. This is just awesome. This is just great. From my heart, I would say this is a great initiative that GCRI is doing, because this is the only challenge, the wait time in the cancer, that you've addressed as a leader. Hats off, sir. That was really good. Shrenik, sir.
Yeah, see, I mean, the basic idea is all about captaincy. It's all about leadership. If the leader is capable, and if leader is committed to deliver, if leader is absolutely dedicated, then it makes a lot of sense, and then he can certainly pursue. And these are the activities which the colleagues, staff, they are doing it willingly. So doing something by pressure and doing same thing on by voluntarily, that makes definitely lot of sense. And let's not forget one thing: by spending 2 hours, which is about 20% of your day time, you are saving too many valuable lives. Let's not forget. And there you are saving those valuable 20% valuable lives at no extra cost to the patients. And that is really make a lot of sense. I truly admire Dr. Pandya's leadership, and I'm feeling so overwhelmed that I had a privilege and pleasure of inviting Pandya sir, because otherwise we would have never come to know about all these facilities and their dedication, because we always go by the social media and stuffs like that. We really never come to know. And here again, when the most, when the leader himself is speaking, I mean, you have 100% valid reason to believe him. Otherwise, I mean, there are people speaking down the line. Probably you may have a doubt, but when Pandya himself is speaking everything black and white, crystal clear, I mean, I'm truly saluting their dedication, entire dedication to the entire team of GCRI. I'm really so happy that after streaming 12 episodes, this 13th episode is going to be so close to my heart because we are extending a lot of support to the people who cannot afford the expensive cancer treatment. So thank you so very much, sir, for your very valuable time and insight. Over to you, Ravi.
Yeah. Thank you, Shrenik sir. Sir, the last question from my side. As a common man, if I have a family member who is suffering from cancer, and if I'm not in Gujarat or Ahmedabad where GCRI is there, what are the things I need to check in the hospital before I admit? So how do I choose the right hospital? How do I know that this is the hospital I should admit my friend or family member out there? So any prerequisites? What should I look for? I'm a layman, so we are not cancer experts to determine which one is good or there's no rating. हम लोग बहुत कंफ्यूज हो जाते हैं एड्स देख के जो whichever is shiny we generally go towards it. Wherever there is a celebrity endorsing it, we वहाँ पे मतलब उस तरफ निकल जाते हैं. So as a layman, as a normal customer, as a customer with a family member who is a patient, बहुत confused रहते हैं. तो what is the suggestion you have? What should the family members look for before taking them to a hospital for cancer treatment?
Really difficult question you have asked me. I will always tell regarding GCRI. Okay. According to me, whenever we go for any treatment to any hospital, we should inquire regarding that hospital. We should see the packages of that hospital, that how much they are charging. Another thing, if it is teaching institute, I would like to prefer the teaching institute where you can get 24/7 treatment. You can get 24 hours emergency services also, because we have a lot of students and they are working 24/7. Somebody may be on the duty, so you can get better treatment. You can get ethical treatment. You can get best treatment. So wherever it is academic institute, I would prefer that. And according to your financial condition, you should choose. But if anybody will ask me, I will say for GCRI, and GCRI.
Yeah.
I would like to add one thing, Mr. When you have started from 1st April 2019 to work extra hours, at that time, each and everybody has supported me. My doctors, colleagues, anesthetists, surgeons, pathologists, those who are frozen section. So I would like to say all have supported me, all doctors, all students, all paramedics also, servants, nurses, technicians, all have supported me. And because of the support of them, we are working during extra hours. And because of working extra hours, we can reduce our waiting list.
True. So I agree with you, sir. And without the support, and not all leaders can make this happen. So they trust you so much that they've agreed to, spend or spare those family time for you and for the people, for GCRI. So Thanks a lot, sir. Thanks a lot for addressing all the questions. Again, for the people who have watched this or joined this later, Dr. Shashank has mentioned about all the schemes available from the government, all the schemes available from GCRI and other NGOs. So if there are any poor people, GCRI is the destination where you can get the treatment. Treatment ranges from around 4,000 rupees, 8,000 rupees, and it's a package. So no more surprises where you're getting discharged and you don't know how much you have to pay for. And he's also discussed about what are the advantages, what are the technologies which are available with GCRI. Some of the technologies they have is like the first in such of the institutes, which no other institutes have it in India, and the awesome staff they have, who are really inclined towards serving the poor. So these were the things which were discussed. So I would like to thank Dr. Shashank Pandya for joining, taking the valuable time out and discussing this, because बहुत सारे लोगों को पता नहीं रहता कि there are such schemes available, and every time the doctor or the staff at the reception has to go through the entire thing again and again with every patient. So do spread awareness. This show is all about spreading awareness. So thank you, sir. Shrenik sir, over to you.
Yeah. So yes, Professor, I must say that today, this being our 13th episode, you have absolutely and most wonderfully added feather in our crown for the end series we are doing. We have started in end of October, and yes, I believe that neither me nor Ravi, we are not doctors, but at least by bringing you on our platform and insight and details, financial aspect, etc., whatever you shared, too many individuals will be getting benefited like anything, and at least we would be indirectly participating as a catalyst to save valuable lives of some of the people across India. So thank you so very much, sir, for your very valuable time, and we would love to have you once again in some time. So thank you so very much, and we look forward to have you once again. Thank you.
Thank you, sir. Namaskar.
Thank
So,
you.
looking forward for more seats in GCRI. May the medical council, allocate loads and loads of seats so that more, doctors, come to the field to save poor people under your guidance. So, thanks a lot, sir. These blessings will definitely, take you to the next level. Thank you, sir. Thank you,
Thank you.
friends, for joining in. Do share this particular video, which will help poor family. Thank you. Thank you, Shrenik sir, for this initiative. Thank you.
Thank you. Thank you.
Okay, sir, we're off live.